Thank you for joining us. Now, today, we want to provide an update on a topic that I know many parents and grandparents are focused on: the potential for the first COVID-19 vaccines for kids under 5. We have waited a long time for this moment, more than 2 years into the COVID-19 pandemic, and after nearly 18 months since the first set of vaccines became available for adults, we are on the cusp of having safe, highly effective vaccines for kids under 5. We are not here to prejudge the outcome of the independent, science-driven process that is being led both by FDA and the CDC. The FDA's advisory committee is going to be meeting next week on Tuesday, June 14th and Wednesday, June 15th, to review the data that was submitted by Pfizer and Moderna, and they will make their recommendations. We expect the FDA to make a decision shortly after those meetings. If the FDA authorizes and CDC recommends that kids under 5 get vaccinated, vaccinations will begin quickly thereafter. So what does this mean for you if you're a parent or a pediatrician? Realistically, it means we could see shots in arms of kids under 5 as early as the week of June 20th. So we think that vaccinations would really start in earnest on Tuesday, June 21st. And importantly, the vaccination program is going to ramp up in the days and weeks that follow, with more and more doses and more appointments becoming available.
We are making 10 million doses of vaccine available initially, with millions more available in the coming weeks. This approach allows us to seed communities with enough vaccine so that it is readily accessible and equitably distributed across the country. We estimate that 85% of children under the age of 5 live within 5 miles of a potential vaccination site.
More than 30,000 children under 5 in our country have been hospitalized with COVID during this pandemic, and nearly 500 deaths have been reported in this age group. So I know how eager many parents and caregivers are for good news on this front, to know that our youngest children have an added layer of protection.